Hi, I'm Dr. Anthony Levenda with Lakeshore Bone and Joint. Today I'm here to talk to you about rotator cuff repairs. If a patient presents to me into my office and it has been determined that the patient will benefit from a rotator cuff repair, I describe the procedure, the surgery to them. Generally, it's an outpatient procedure. Majority of them are done arthroscopically, approximately an hour or less to perform. And what we do is, this is a model of the shoulder with cameras and equipment with the same diameter as this pin. I'm able to arthroscopically evaluate the rotator cuff. Here's the rotator cuff, two in the back, one in the front, and one on top, and evaluate where the tear is. And essentially, arthroscopically, we are going to grab some tissue or the tendon and reattach to the bone where it pulled off. And the way we adhere it to the bone is we would drill holes in the bone, put a screw in the bone, and on the end of the screw is some thread or fishing line, very strong, and we sew it through the tendon. And this can be done arthroscopically, not through a large incision. And depending on the size of the tear, we'll determine how many anchors or sutures we have to use. In addition, we can use grafts, we can inject stem cells from the patient into that area to help facilitate and promote healing. Once this is done, the wounds are closed, patient is placed in a sling, and we'll begin formal therapy within a couple days. We generally start with passive motion, meaning the therapist moves the patient isn't actively moving the shoulder, because that puts tension and possibly can lead to a tear of the tendon. The suture that we use, or the thread we use, is a temporary fixation until the body heals this. The sling is generally worn for 6 weeks. If it's a severe tear, we have to use a graft augmentation, possibly 8 weeks. We begin active motion around 6 weeks, with strengthening around 10 to 12 weeks. Full recovery, depending on the size of the tear, it can be between 4 to 6 months. I always tell patients that even after 6 months, they will have some aches and pains because the shoulder is deconditioned. And I generally tell them it takes about a year until they're fully recovered. Some complaints or some issues they always address in my office is it's difficult to sleep on that side for a while, and that's true. It does take some time, but generally patients do very well after the procedure.